Hi guys, this video is about other things you have to keep in mind when doing your strength training exercises. That it's not just a pure strength when it comes to Achilles tendon rehab. So my name is Maryke. I'm one of the physiotherapists from treatmyachilles.com, where you can get online physiotherapy assessment as well as treatment for your Achilles injuries. Have a look at the description of this video if you want a link to our website. Okay, so we know that a combination between strength training and load management seems to be the best treatment option we have currently for Achilles tendinopathy. But the interesting bit is that program is not standardized between patients. So even for two distance runners, you'll have two very different exercise protocols sometimes that they follow, and both of them actually recover and get back to full training. And that is one of the things that's puzzling researchers to an extent, because if it was purely about the strength of the muscle and the strength of the tendon, then it should be a very easy thing of just strengthen it all up and back you go to running. What they're now starting to suspect is that your neuromuscular control may also have an effect on Achilles tendinopathies. Now, neuromuscular control is how well your brain controls your muscle contractions and your body's movement. We also call it motor control for short. And what the research is showing is that in people with tendinopathies, there's a difference between the motor control of that affected limb compared to uninjured controlled people's limbs, but also often a deficit in control compared to the injured limb or the uninjured limb. And in some cases, both the limbs will have a decrease in control compared to uninjured people. So there's definitely something to do with control in there that maybe be affecting Achilles tendinopathy. They're not quite sure whether it causes the Achilles tendinopathy to develop in the first place, or whether it actually develops in reaction to the tendinopathy. But they also don't understand yet how important that is for symptom resolution. So what they're thinking is that maybe the reason people re-injure themselves is that the strength deficit is taken care of, but we're not properly retraining the motor control issue that that patient has. So how do you retrain motor control, or how do you see if you've got a deficit in motor control? Now, it's not that easy to see it with the naked eye usually, but for Achilles tendons, you can actually observe it in the drop down phase of the heel raise. Let me see if I can demonstrate this to you. So what we're looking for is if somebody has good motor control. Now let me just get it so that you can see my feet better when I do this. There we go. We're looking for smooth movement with no shakiness in it. So if we think of the classic heel raise going up and down, then you want to see it as a smooth movement coming down without any shake. Now if I can show you if I do it on one leg, look at my lowering down, there's a little bit of a shake, and at the moment you can't see it that well, but if I had to exaggerate it, it feels something like that. So you can feel that it's just not a smooth movement coming down, and there's a bit of a shake. And what we're looking for is actually a lovely, smooth, slow lower. Now, can you see that if I just drop down, you wouldn't really see anything, because it's now just gravity taking it down, and it looks as if I've got a smooth movement. But as soon as I slow it down, then I can feel my shake coming on. Now, in that movement of mine, I didn't have that much of a shake, but often when I test my patients, and I get them to especially do the bent knee heel raises, you'll see the soleus control. It goes shake, 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 and after repetition number 5, it's all shaky altogether. And that's a sign that the motor control of that eccentric contraction is just not there, and that's something that they need to actually develop and retrain. How do you retrain it? The research is showing that if you just do exercise, strength training exercise at your own pace, so you're just going up and down at whatever pace you want to do, you're thinking about what lunch you want to get or what supper you're going to cook, your motor control won't improve. You have to do exercise where you're focusing on controlling that muscle. So in the studies they did, they found that if they made the patient do the exercise to a metronome, so they had to keep up at certain beats with it, or they gave them a visual cue that they had to do it according to a little ball that went up and down, then the motor control improved. And it was because the brain had to actively think about how to control that part of the body in line with the external stimulus. So in practice, what we find is it works quite well if we tell patients to slow the movement down so that they take 3 seconds to get down. So they're actively thinking about how slowly they're lowering it. Dr. Seth O'Neill has another method. He makes people stop at certain points during the movement and then reverse the movement, but for specific directions. So he'll get them to do a heel raise, go up and then drop only 50% down, go up a quarter, go down 2/3. So you get what I mean. It's not just about do it at will. You have specific portions where you stop, specific portions you go back to. So it doesn't matter what cue you do, as long as there's something that tells you that you need to concentrate on this movement. Okay, I'm taking it up, I'm taking it down, I'm taking it at this speed. Then you're realigning the brain and teaching it how to control that part of the body properly again. Excellent. So let me know if you've got any questions, but the main takeaway of this video is that it's not just about whacking out your strength training as quickly as you can. Slow it down, especially at the start, and think about it. Think about every single movement, because it teaches you proper motor control again. If you need more help with your injuries, you're always welcome to consult us via video call. Link to the website is in the description of this video. Take care.